Decrease central line infections by Eric Nicola. Central venous catheters are vitally important in treating hospitalized patients. While these catheters often deliver life-saving treatments to infection, blood products, and fluids to critically ill patients, they can also be a pathway for microorganisms to enter and cause infection in the bloodstream. These infections are referred to as central line associated bloodstream infections, or CLABSI. Central line associated bloodstream infections are a primary laboratory confirmed bloodstream infection in a patient with a central line at the time of or within 48 hours prior to the onset of symptoms, and the infection is not related to an infection from another site. CCH has initiated a quality improvement project to decrease CLABSI rates within 1 year. Aim statement. The aim statement for CCH is to decrease central line associated bloodstream infections by 80% by December 2020. This will occur by increasing education and return demonstration by employees who will perform insertion. Staff will be educated on signs and symptoms of infection as well as proper aseptic technique. A screening tool will be added to daily charting to catch early signs and symptoms. Decreasing these infections will benefit the patients, the hospital, and staff. Action plan. Staff will be educated on 3 components. First, they will be educated on proper aseptic/sterile technique, then on the actual insertion itself, and finally on signs and symptoms of infection. After education, staff will be required to perform a return demonstration to display what they have learned. In addition, a CLABSI screening tool will be included in daily charting to help catch early signs and symptoms and to be sure that staff is adequately assessing insertion sites. These actions will come out in phases over a 6-month period. First with education, then return demonstration, and finally the screening tool. This started in December 2019 and is projected to finish by December 2020. Education has already begun and will finish in February. Return demonstrations will begin immediately after education is completed and finish in April. The final phase of the screening tool will roll out in June. This will be completed by the Infection Control Department of CCH and outside resources. Cotter's change model. Mambato and Whiteman state that utilization of change theories help the facilitator to deliver change through a systematic and strategic approach. Cotter believed that the heart of successful change of people's behaviors is to connect with their emotions, to help them see, feel, then change. His change model provides a clear step-by-step guide to initiate powerful practice changes and consists of 8 steps in 3 stages. Step 1 of Cotter's change model is establishing a sense of urgency. This will be done by educating staff on the high rates of CLABSI infections at CCH and the statistics of how harmful this is to patients. Creating a guiding coalition is step number 2. This coalition will consist of CCH's Infection Control Department and head staff members from departments who are caring for patients who have central lines or are inserting them. Step 3 is to develop a vision and strategy. The vision for CLABSIs is to be decreased, and the strategy is through use of education, return demonstration, and additional screening tools. Step 4 is communicating the vision of change. This action plan will be dispersed to staff via meetings and emails that will include a step-by-step itinerary of the action plan. Empower employees for action is step number 5. This will be done by giving employees an opportunity to voice their opinions on said action plan and including them in every step of the process. Step number 6 is to generate short-term wins. Short-term wins will be generated by celebrating employee success in completion of education and return demonstration. Step number 7 is to consolidate the gains and produce more change. This step is about sticking with the changes implemented. This will be done by showing employees statistics on how this plan has decreased infection and that all of their hard work is paying off. Step number 8 is anchoring new approaches in the culture, or making it stick. This will be done by continuing to measure the incidence of CLABSIs and ensuring that rates are not increasing. Using Cotter's change model would set clear steps in place and allow an organization to fixate on what needs to be done. This model includes the employees in the change and allows them to get an understanding of why the change is being made and why it is important. Process measures. Process measures indicate what a provider does to maintain or improve health, either for healthy people or for those diagnosed with a healthcare condition. These measures typically reflect generally accepted recommendations for a clinical practice. In terms of this project, the process measures would be set in place to ensure that staff is following the new protocol properly to decrease CLABSI rates. Measuring the success of this project will be conducted by a staff survey. A pre- and post-education survey would be dispersed to determine the knowledge of staff prior to and after education. The goal of this measure is to see an increase in knowledge of CLABSIs by staff. As presented by our graph, you can see that staff education was increased. Outcome measures. Outcome measures reflect the impact of the healthcare service or intervention on the health status of patients. Outcome measures are used to determine if new protocol is having a desired effect. In this project, decrease of CLABSI rates. Outcome measures will be collected by tracking rates of CLABSIs after new protocol has been released and in comparing this data to CLABSI rates prior to new protocol. The goal of this measure is to see a decline. As you can see, the rate of CLABSI rates has decreased substantially since this QI project. Wrap up. There are many factors that go into a performance improvement project. Identifying a problem in the organization and using that to create a mission and vision statement is a starting point for any organization looking to serve its stakeholders. A SWOT analysis also contributes to performance improvement by clearly stating the organization's strengths, weaknesses, opportunities, and threats. This allows the organization to understand what they are doing right and what needs to be improved on. Next, an aim statement is conducted to specifically state the intentions of improvement, who this will benefit, and when and how this will be completed. Finally, empowering its stakeholders may be the most important factor of all, ensuring that all those who hold a vested interest in the organization that they are making strides towards improvement makes stakeholders feel valued and heard. The action plan was strategically set in place and Cotter's change model was utilized to ensure smooth transition and that no shortcuts were made. Process and outcome measures displayed the success of this project. The decrease of central line associated bloodstream infections at CCH has benefited all stakeholders. CCH has seen a dramatic decrease in patient mortality, increased patient satisfaction, and staff who feel valued and appreciated. It is important for organizations to use these important improvement factors when conducting any quality improvement project. Resources. Thank you.